There's so many different types of heparins, as you can see here. It is super important to know why we're giving it, how to give it so we can confidently select the right one, and how to evaluate to make sure it's working for our patients. First one I want to share is this one right here. This is a pre-filled heparin syringe for flush and lock. So it does say flush and lock on the syringe. This is for central lines. We would use this to instill the heparin solution into the line, and it just sits there. It sits there so that the line doesn't clot. So we can continue to use it. It maintains patency, and we have it for transfusions and blood draws, for example. This can also come in a vial form. In this case, if we're going to instill heparin to make sure a central line stays patent, we need to make sure the vial that we are drawing out that heparin is the correct concentration, the correct volume. Because typically lines will need a concentration of 100 units per ml and anywhere between 3 to 5 mLs typically to sit in that line. These may also say for IV or subcutaneous use, and in that case you may be giving a subcutaneous dose of heparin prophylactically, so we give that to maybe post-op patients to prevent them from getting DVTs. Typically though, that'll come in a single dose mini vial like this one, and it comes as 5,000 units, 1 ml. We would draw this and give that subcutaneously. Sometimes you may also have to draw that subcutaneous prophylactic dose from a bigger vial, a multi-dose vial, and in that case we need to really look at the concentration and make sure that we have the appropriate 5,000 units in our syringe before we give that subcutaneously. Sometimes we may also need to give IV push heparin, and that would be for actually treating a clot. So for patients who are diagnosed with a DVT. And lastly, heparin drips. So we might have different bags of heparin. We need to make sure we have the right concentration so that we can input the correct order into the pump. And this would be for an actual diagnosis of an embolism or DVT. That's heparin.